Welcome back to Beyond Well. I'm Sheila Hamilton, and I'm so happy to be joined today by Anna Florence. She's a clinical psychologist with experience in deinstitutionalization and the implementation of community-based mental health services. And her research interests include the medicalization of poverty, the social determinants of health, and the open dialogue approach. Dr. Florence's doctoral thesis describes how the open dialogue approach originally developed in Finland and as a form of psychotherapy and a way to organize mental health systems was received, adapted, and implemented in 2 locations in the United States. She's currently a Postdoctoral Associate at the Yale Program for Recovery and Community Health, working in partnership with the Department of Mental Health and Addiction Services in Connecticut. Anna, it's so wonderful to talk with you. What an incredible background you have. So fascinating.
Thanks so much for having me.
I want to first talk, if you don't mind, about deinstitutionalization. Right now, there is so much discussion about the number of people who are suffering from really severe mental illness, some of it exacerbated because of COVID-19, and the lack of places for people to go. So talk to me about how you see deinstitutionalization working on behalf of that very, very sick part of the community.
I mean, that's a great question. I should first say that I'm Brazilian, so most of my experience was in Brazil, and I know that the reality there is very different from the one here in the US. But I think this whole pandemic situation has really just turned our worlds upside down. And it has showed how vulnerable, especially those places where people live very close together, really are. And I think that, along with nursing homes, also psychiatric facilities are really being tested as places where the virus is just transmitting in a very worrisome way, and people are not being as protected as they should be. Now, deinstitutionalization is a very long process. It happens, it takes years and years to close down a hospital, for instance, which is what I did in Brazil, and kind of gradually move people back into the community. And the moment that we're facing right now is kind of demanding that we respond very quickly. And I think we weren't really prepared to really answer to that in a good way. So I'm really concerned to see what's going to happen. And I'm not very optimistic that we're going to be able to protect those people the way that we should.
Anna, you bring up such a good point that it takes decades-long planning, it takes buildings, community network support, individualized care, all of the incredible social safety network that we have to offer people who are this vulnerable. But is there any sort of in-between system that would allow for a safer environment for these people that would take less of that long-term planning? Have you been thinking about that at all?
Yeah, and I think that I've been seeing that with my work in the Department of Mental Health, is that there has been a very quick effort to make sure that people have structures in place to guarantee that they can safely isolate, that people are, having enough distance between each other during meals when they're institutionalized, and in spaces that people usually would, be together, that they're taking turns in doing that. There has to be a coordinated plan, and that has to be put in place very quickly in order to protect those vulnerable populations. But on the other hand, that also reveals problems that were already part of the institution, and then they suddenly, when there's a crisis, they become really more evident, such as understaffing, such as institutions not being appropriately funded. And that really calls for some quick and immediate responses if we want to make sure that those people are safe. But also, I feel like this is an opportunity for us to think about these places. Right now, people are becoming so vulnerable that we should really take this as an opportunity to rethink the need for these places and to speed up processes of recovery and reintegrating people into society rather than these institutional places. So I think we should take that as an opportunity as well.
I've been thinking a lot about this just because of the problems that we're having right now in prisons, nursing homes, and psychiatric institutions. Those seem like they're going to turn into the biggest hot spots and the ones that we're really not capable of controlling. Is there any alternative right now that you're seeing in terms of, are people safer in small group settings, individualized care? Or is there any creativity going on right now to be able to get people out of these hotspots?
That's a great question. And I think that there are several initiatives looking at that. I personally feel that we should be pretty radical with what we propose. I think that there are a few groups, at least I know here in Connecticut, there are several groups that are advocating for people to be released from prison when they weren't charged with violent offenses. And so I think that that's really one way to kind of address this issue more immediately. When it comes to people who really need a lot of support in their daily life, I think we have a trickier situation. We certainly would need a bigger ratio of professionals to individuals who are in these institutions to make sure that they're getting everything that they need, while at the same time we really need to reduce the number of people that are together in the same place. Yeah, so I think that those are two ways to address it, but I'm sure there are other initiatives that, you know, people are advocating for that, you know, really take this opportunity as a chance to really challenge some of the practices that we've had. Especially around incarceration. We know that there is an incredible racial problem there that was not being addressed, and maybe this is an opportunity to address it. But also these populations are not just institutionalized in prisons and psychiatric hospitals, but they're also vulnerable and marginalized for several other reasons that we might, you know, want to reflect on right now.
Yeah. Can we talk about the medicalization of poverty and how COVID-19 is going to increase all of these forces that cause poverty?
Yeah, this is a really important issue. And I also think that this is a great moment for us to discuss it. I think that we've been seeing around the media something of a narrative emerging that, you know, this pandemic is going to lead to an epidemic of mental health problems or mental illness. And so I feel like already there is a narrative emerging that is going to focus our understanding of what's happening in a very individualistic level. And so people are going to have some type of pandemic PTSD or some type of depression related to this, when in fact what we know is that people are struggling with losing their jobs, with losing their livelihoods, with not being able to pay rent, with food insecurity, you know, a number of social issues that are related to the fact that there isn't really a good welfare system in place, that people are falling through the cracks, just an absence of a well-structured welfare system. And also as a result of recent, you know, policies of economic austerity, and, you know, just the lack of job security and other social and economic issues. So I think that it's very concerning that a lot of this is already being framed as mental illnesses, as medical problems, and as things that people are experiencing as individuals. I really feel like it's a nature of this, so we can mobilize collectively and deal with this collectively, rather than further isolate into thinking that we're somehow reacting bad to this.
Yeah, I love that thought. You know, if we could stop medicalizing, you know, and giving everyone a diagnosis because they're suffering without jobs and communication and a social fabric. That's a really, really excellent point. I want to talk about your interest in open dialogue and how you see the framework of open dialogue being beneficial for people during this time.
I became interested in open dialogue when I was a clinical psychologist at a community mental health center in Brazil. And I was just really bothered by the fact that people I was seeing were not really finding medications all that helpful, and often they lied about taking them. So I started to build a relationship with people around this whole medication issue. And in the sense that I offered to be with them as they experimented with reducing or coming off these drugs. So to my surprise, and against all that I had heard in my training, we were pretty successful in doing that. So I thought that I should find an approach that kind of addressed that issue of the medications more directly. And so that's kind of how I became involved in this. And mostly I learned about open dialogue through Robert Whitaker's book, Anatomy of an Epidemic, as many other people have. There's a lot of things that I could talk about open dialogue that are incredibly important for this moment, especially with this whole pandemic situation. One thing that I would highlight is that I've been talking to a lot of people that practice open dialogue here in the US, and they have been able to conduct network meetings online through Zoom and other platforms. And so they have been able to continue the work with the families that they serve. So that I think is a very good outcome for this, in the sense that people don't have to stop their treatment because of social distancing. There has also been talk about this being one of the most dialogic moments in history, maybe. And as you know, dialogicity is an important element of open dialogue. And so the way that people are connected nowadays really highlights a little bit the importance of dialogue and fostering a special type of dialogue that open dialogue is very good at doing. So yeah, I think, I don't know if there's more of a place for open dialogue right now, but I know that a lot of what we're going through reinforces the need that come from the principles and the elements that open dialogue really values in its practice.
And I'm so interested because you have worked in so many of the really deep areas of social health and public health. And I'm very curious just about how someone like yourself weathers a storm like this when you're always thinking about it at the 30,000-foot level and the wide swath of people that will likely be left behind because of this pandemic. How do you keep your own spirits up?
That's a very good question.
Yeah.
I guess on a more personal note, I've always worked in the public health system in Brazil, so I've always seen extreme poverty, and I've always seen a lot of the suffering that comes with that. And also, all of my career, I've been interested in knowing more about how poverty, lack of access to health, and other, social determinants of mental health play a role in how people suffer. But up until this point, I think that I felt some distance from what I've been studying and seeing. Right now, I feel like I'm part of this, like I'm in the middle of it, that I'm being equally affected as everyone else. I wouldn't say equally, just because I still have a job, I have a place to live, I have access to internet, I have food in my fridge. So a lot of the things that people are losing right now, I have. And so I acknowledge that privilege and going through this crisis from a place of privilege. Mm-hmm. But it's been very difficult to me to make sense of what's happening. I have been finding myself with thoughts very scattered, having a hard time concentrating, focusing on my work. And I've in fact had to completely change what I've been working with just because it stopped making sense to me. And I'm currently working and coming up with new projects that are more related to the current situation. That has certainly helped. But the feeling that staying home and washing my hands is a very weird feeling, and one that I'm having a really hard time grappling with.
I hear everybody in the U.S. commercials going, we're all in this together, we're all in this boat together. And I was like, God, not really. Our boats look really different. And Anna and I have groceries and internet, even though it's sporadic. We don't have these, the life and death concerns of people who haven't yet received any money to be able to feed their families. And yeah. I think it's so important for people to always acknowledge, like, here's where I'm at. It doesn't mean, that I don't have any suffering or any difficulties, but geez, just the sheer humanness of being able to say, but I know I'm so much more comfortable, I'm so much more safe, I'm so much more privileged than so many people, and yet I'm still suffering. Can you imagine what that must be like? I'm hoping that in some ways this is a huge empathy experience for people, that they just begin to say, oh, okay, now I see what happens to the human mind when you are stressed for a place to live. You are
Yeah.
stressed for groceries. You are stressed to be able to connect with other human beings, you know? I think it's
Yeah.
a really amazing opportunity that we have before us right now.
That's exactly right. And I do agree. And I've been feeling it, this weird thing that being a clinical psychologist and having a PhD somehow, people think that you have, some expertise, and it's true that we do.
Yeah, right.
Yeah, some expertise, of course. But at this moment, I wonder who has the right to claim that they know more about going through a global pandemic than the other person. And I certainly feel that way. I do have all this background and, my research and everything. But in a sense, it's a very humbling experience to be very aware that no one really knows how to deal with this. And I have been investigating this interesting phenomenon. I think that maybe this is a good moment for us to challenge the notions of normality. Who can say that what reaction is normal right now and which one isn't?
Yeah.
And so many people who never thought that they would experience some kind of mental health issue are now finding themselves completely lost. And all of these things that we traditionally think of as pathological. And so how are we going to address this now that everyone is feeling those things that we thought were reserved just to, this minority of people who have like abnormal experiences with reality?
Yeah.
And I think that one interesting, just wanted to mention one interesting thing that someone told me was that and this is a person with lived experience saying that when they became psychotic, people told her that she was breaking from reality. And now that reality is breaking for all of us, what are we going to call that?
Oh my gosh, what a great line. Wow. Boy, that just sent chills up and down my body.
Yeah.
Yeah, well, if anything, what I've been really cheered by is that my friends who have gone through extreme states and lived experience seem somehow better equipped to deal with this than a lot of other people, because at least they've really practiced the tools that are self-calming, and they know how to reach out for peer experience and peer help. And I'm just like, wow, okay, maybe the new reality is that we have a lot to learn from people with lived experience.
Yeah, so that's exactly right. And that's what I'm investigating right now in my new project.
Oh my gosh, that is so exciting, Anna. That is really cool. Really cool.
We're looking at, what types of wisdom and what type of knowledge do people with lived experience, and I consider myself a person with lived experience as well. So what type of knowledge and wisdom do we have to offer, considering everything that you just mentioned? Like people have gone through this, and, people who have had to self-isolate before because they have some kind of medical illness, like an autoimmune disease or cancer. What types of knowledge they have to offer? They've been through this. And also I'm doing these listening sessions where I invite people to talk about the whole pandemic situation from a place of lived experience. People who have gone through extreme states or psychosis or whatever you want to call it, they maybe have some kind of superpowers right now and some great skills to share with the world. And we're definitely trying to look at that and sharing that wisdom with everyone else. And also someone said something that I thought was very beautiful, that people with lived experience have experience with trauma, but they also have experience with from which we're going to have to recover together. And so I guess having gone through that journey of recovering can be a great asset into seeing a future and to see an end of this and trying to imagine a new reality. So a lot of really interesting things coming up.
Oh, Anna, I do hope you'll stay in touch with me and just let me know how this research progresses, because I'm fascinated by the topic, and I think you're absolutely on to something that sounds like real truth and truth that human beings really need right now. Thank you again so much for spending time with us, Anna. It's really been wonderful.
Thank you so much for having me.